Welcome to Hala City. Today we have a special episode. Today we have a special occasion. Today is City Hospital 15th year anniversary. And we're so excited to have three distinguished guests here with us today. Mr. Hein Van Eck, the CEO of Mediclinic Middle East, Mr. Barry Bedford, the COO of Mediclinic Middle East, and Mr. David Eglington, the Hospital Director for City Hospital. Hein, could you tell us how City Hospital grown and evolved over the last 15 years?
Yes, Dr. 𝗖𝗀𝗃𝗶𝗶𝗃. I must say City Hospital holds a very special place in the hearts of Mediclinic, not only Mediclinic Middle East, but also Mediclinic International, because it was our first greenfield hospital that we commissioned outside of South Africa and the first one in the Middle East. So when we came to Dubai and we did the transaction in Dubai, City was really just a hole in the ground. So we had to redesign the plans around it. It was always planned to be a tertiary facility, but we realized that you can't start a facility as a tertiary facility. You have to build the trust of the community. You have to start with the service lines and the disciplines that reflects the population.
Sure.
And that's what we did. So we got good volumes going, and then we transitioned to becoming more tertiary. And it's really become the flagship hospital, not only for Mediclinic Middle East, but I would also say for the whole community of Dubai and the UAE.
Excellent, excellent. Barry, could you touch on the most significant milestone for City Hospital?
Thank you, Doctor. There is so many. But after we opened in 2008, I think one of the biggest milestones in 2016 was being the first private healthcare provider doing kidney transplants. The same year, we were also privileged to open our comprehensive cancer center, which I do believe played a fundamental role of cancer treatment within Dubai. Yes, recently we celebrated our first 1,000 surgical robotic surgeries being done at City Hospital. But I think it will be for us critically important to highlight the importance of the signing of our affiliation agreement with MBRU as a key highlight within Mediclinic City Hospital.
That's fantastic. That's fantastic. David, could you tell us a patient story where their lives has been turned around by the care at City Hospital?
I think for me, Dr. 𝗖𝗃𝗍𝗃, you know that there are every day there's kind of some really special stories. But I think for me, actually, the things that really sort of stick with me are some of the perhaps the cancer survivor stories that we have. And it's not just the treatment they have; it's more about the impact it has on their lives. We have many patients that have come through cancer treatment, and they've been through an awful time, a tough journey, and they've come through the other side, and then they've gone on to have really meaningful lives. They've gone and taken up new pursuits that they wouldn't have had before. You get to know the families, and you know the impact it's had on the families. One of our patients, in fact, there's 2 or 3 of our patients that following their cancer journey, they've then gone on to, one of them has even started their own charity, the Cycle for Cancer, where they raise awareness but also funds for treatment and research. There are others that have set up support groups. We also do pediatric oncology, so childhood cancer, which is tough when you're walking through that ward and you see the children there, but it's quite humbling as well. And there's a young boy who was only 10 and was diagnosed with leukemia, and his treatment was ongoing for about 3 years. He probably spent more time in the hospital than at home.
Wow.
The team got to know him, and during that time he learned to play the guitar. And at the end of his treatment, he rang the bell. He'd written a song, and he sung the song when he rang the bell. So it's those kind of things. It's almost every day we treat hundreds of patients, but it's more about the impact, the positive impact it has on his lives. And Barry and I were talking about this, how humbling actually it is to be in healthcare. When you think about it, how the impact you can have on people's lives, and not just the patients, it's the families as well. So yeah, many stories.
Absolutely, absolutely. Hein, COVID-19 have affected the whole world and changed the whole world. How did it affect City Hospital operation?
Yes, Dr. 𝗖𝗃𝗍𝗃. I mean, City Hospital played a huge part during COVID. All our facilities played a fantastic role during COVID, but we had the luxury at the time that we had multiple facilities. Of course, we don't just have one hospital in the UAE. So what the city team could do was, it was very important for us that the cancer patients are safe from COVID.
Sure.
And there were also this huge demand for elective surgeries, which couldn't be done in the other facilities because of COVID being present. So we really pushed them to become COVID-free, while our other facilities took the brunt of the actual COVID patients. Not that City didn't see any, but that was a very important role for us.
Sure.
They also played a big part in commissioning some of the isolation facilities on behalf of government in hotels and these kind of places. So the team really pulled really hard and played a huge role.
Amazing, amazing. Barry, there's a lot of new technologies, medical health technologies that is coming through. How is City Hospital adapting to those?
Firstly, if you look of seeing what is currently at City Hospital, we're one of the few hospitals with a 646 slide CT scanner. We're sitting with a LINAC machine, we're sitting with surgical robotics. But the future of healthcare is to integrate ultimately technology within the care plan of the patients. But if we talk about technology, it can only be successfully operated with human beings. And we're sitting with exceptional doctors, exceptional nurses, integrating this technology to the best interest of our patients.
David, what role has the hospital played in the community health and well-being?
Yeah, I think when you talk about the role, it's also responsibility that we have. And I think at Mediclinic, we take those things incredibly serious. It's a large organisation with a well-established brand, and it's really important that we do the right things. Not just as a healthcare professional, you need to do the right thing, but as an organisation, we need to make sure that we do as well. And I think as a result of that, the stories, we have a big impact on people's lives ultimately by treating them well. But it's more about ensuring that we provide ethical medicine. That's probably one of the single biggest things that we do. There is a culture in Mediclinic. We have values in Mediclinic that ensure that we provide ethical medicine. We do the right thing. And I think that's a huge responsibility for us, but I think that we do that very well. It's something that I take seriously, and I know that the team at City takes very seriously. But I think also it's about taking international best practice standards as well and applying that in the UAE, the place that I'm proud to call home. It's a unique opportunity in Dubai. We recruit doctors, nurses, healthcare professionals from all around the world. So we've got the opportunity to take best practice from all around the world and kind of aligning that and providing real quality healthcare. So I think for City and for Mediclinic in general, it's about providing ethical international standards, best practice standard healthcare. And I think as a result, that benefits the local community. And we've seen that with some of the stories that we've talked about earlier, but also just every day we can see that benefit. So,
Hein, this question for you. What initiatives has the hospital taken or set in motion to advance health education and training?
Yes, I think Barry also referred to it earlier, Dr. Sajja. Our affiliation agreement with Mohammed bin Rashid University is a huge thing for us. It's a partnership that started in 2016 already. We started our first affiliation agreement with them, and that at that point in time, City Hospital was the absolute core of that. It's basically the teaching hospital of MBRU. That's where it all started, and today we train across Dubai at any point in time. More than 130 MBRU students is in our facilities at any point in time being taught by our doctors, and basically most of our doctors are adjunct faculty of MBRU. So very important for us. It pushes our doctors. It keeps them on their toes. They really enjoy it. It makes them engaged. So we're very proud of that agreement.
Absolutely, absolutely. David, what are your hopes and aspirations for City Hospital as it moves to the next stage?
More success stories, certainly. But I think City, we're proud to call ourselves a teaching and tertiary hospital, a genuine teaching and tertiary hospital. And Hein just mentioned the teaching part. That's important. And we want to be able to free up capacity to make sure that we can teach more students, more young doctors, which is a kind of a good sense of, as Hein said, it kind of almost holds us all to account. It makes us think. Not something that we learned 20 years ago and been practicing. You think about new ways. It's more innovative. But also it's kind of a way of giving back to the community in some way as well. So certainly from a teaching perspective, we'd like to grow the number of students and diversify that a little bit more into perhaps other areas as well. The other thing is from a tertiary perspective, this is something that I think is very special to Mediclinic City Hospital, is that we have grown over a number of years, providing sort of some primary care, secondary care services very well. And as Hein said, that's really the foundation to build a tertiary hospital. And we're really starting to see that evolution now. As Barry said, with the first kidney transplant, I think for me, I would like to see that we become a multi-organ transplant centre that Dubai can be incredibly proud of, that the UAE can be proud of as well. We already provide complex services like cardiac surgery. I'd like to see those things grow and evolve as well. So we've got everything in place, all the foundations, the team, the doctors, the nurses. We have really good experience and good volumes coming through the hospital. But I think it's around teaching and tertiary that I really want to see his City Hospital to evolve and be something that the local community, we're very proud of City Hospital, but the local community is proud that we're here in Dubai.
That's fantastic. So I will say inshallah.
Inshallah. Yeah.
Knowing how busy your schedules are and the fact that I can have you all in one room is absolutely amazing. So thank you so much for taking the time today.
Thank you, Dr. 𝗖𝗍. I also just wanted to say happy birthday to all our colleagues at City Hospital. 15 years is absolutely amazing. Well done, guys.
Happy birthday.
It's been an absolute pleasure. Thank you. Thank you for joining us today on this special episode. Stay tuned till next time.